Thomas, this is a view inside your knee. What we've done so far is inflate the knee with sterile fluid. And I brought in the shaver. That's what this thing is. It's 4 millimeters in diameter. So this is a big space. We've pumped some sterile fluid into the knee. This is the undersurface of your quadriceps. So it's as though we're standing on your leg and looking back up into the knee. The kneecap is above us, right there. Those surfaces look great. I'm going to get the shaver out of the way. The one thing before I leave this area, your synovium is this pink tissue that lines the joint. Yours is just a little bit irritated. It's got a little bit of extra blood vessels, sort of extra vascularity. And it's kind of fun to get in here close because sometimes you can actually see individual red cells zipping around. Yeah, you can see the little boxcars lining up on some of these vessels. Anyway, it gives you some perspective that we're really quite magnified. Anyway, this is not a diseased knee by any means. It's the look of a knee that's a little bit irritated. Probably your meniscus here would explain all that. So let's look underneath the kneecap. There, the kneecap again is above us. The front of the femur is below us. Here's the knee flexing. These surfaces look terrific. This is a tissue called a plica. And let's see if it's causing any erosions. I'm not sure that it is. I don't think that's the problem. Let's drift down now to the inner weight-bearing surface, which will become visible right there. And there is the problem. There's the meniscus tear that we thought was here. Look, please. Right there. And this is a critical weight-bearing area. And so this is clearly this is the trouble. So what we'll be doing is trimming out this tissue right here and trimming out some of this tissue right here and leave this a smooth weight-bearing surface. This is what we've got this abrasive sort of crab meat appearance is what we've got to get rid of. So this thing looks huge. It's actually a relatively small tool. It takes sort of 1 millimeter bites. There's one side, and you'll see this sort of makes a mess temporarily, but we always clean up and then reassess where we are. Shaver will remove the loose bits. It'll also do a little polishing on these surfaces. All right. That top leaflet still needs to go back a little bit more. Sort of turns to the right, it works a little bit better on this angle. So once again, this certainly would explain your symptoms very, very accurately or very well. And once we get this back to stable edges, this should rehab very nicely. So Thomas, we're in good shape now. The front half of the meniscus, starting here, really is fine. The joint surface likewise is fine on both the tibia and the femur. No advanced erosions. This meniscus was in fairly bad shape in the back, but we're back to something stable and smooth there. Likewise, the top rim is stable and smooth. I'm going to just smooth this little bit out here a little bit more. And then we're going to look through the rest of the knee and see if there's anything else to do. There we go. That looks just right. I just want to get this sort of polished or debrided back to a real stable transition. And I think from a bulk standpoint, that's it. Let's just see if the shaver leaves it smooth now. Down the ductile. There's just a ridge right in the center that I want to get rid of. There, that took care of part of it. Yeah, I'm starting to like that a lot. So, there we're done with the medial meniscus to the medial side. Here's your anterior cruciate ligament. And that looks like it's in great shape. Here's the lateral compartment. Also in great shape. No tears, no breakdown. So there's no arthritis in this knee at all. So that's it. We rest for 2 days. We get going on a bicycle. We should get improvement. See you in recovery.